Hello everyone. I'm Garima Vegivada, Speech Language Pathologist from here in Say Clinic. I've been practicing from last close to 12 years now, and I am based in Hyderabad, and I do help people with speech, language, hearing disorders. It's been a journey to actually learn and then share our knowledge with everyone. So today I've been invited by Autism Connect, and Autism Connect is a great platform which is helping people throughout the world. They have maintained a directory of therapists, rehabilitation services on their website, and also they do have lots of resources and resource people into their directory. So if anyone needs to look around for the therapist or any expert opinion near their areas, they can do visit Autism Connect website or their social media pages like Facebook and Insta. So the topic which I have been assigned today and I'll be talking is communication innovation for individuals with autism. So it's an interesting topic, and if you see the journey, if I tell my journey with working with individuals with autism, it's been really interesting, and there's always something new we look for. Like, every child who comes to us, we feel that we can do a lot with the child, and with that thinking of doing a lot, we have actually learned over the years. So when you say communication innovation, the traditional therapies, when we started, it was more like any child reported to us was, we looked the child as a delayed speech and language, and we used to work with the child as a child, and a therapist relationship was more. Over the years, when the autism was reported, more and more children were reporting with autism, we actually started with working with families, because we saw that there is a huge difference when a parent is involved, and parent is actively involved in therapies and helping the child. So we believe in training the parents. So I think that is one of the major innovation and advancement happened over the years, that parents got involved more in therapies and parents started learning. There was earlier the parents used to come for therapy, used to take the therapy of the child and then tell the parent what we did, and they used to go home and do, and over, that's finished. But today the things are not same. We have to train the parents. So I think that's a greatest innovation happened. Secondly, the sensory. Being a speech therapist, we cannot overlook the sensory preferences. Earlier, speech therapies used to happen in a closed therapy room where you used to have some puzzles and some kinds of toys. But over the years, we have figured out that without sensory integration, it is difficult for many children with autism to have a therapy setup. So when therapy is taken in association with OTist, or I prefer taking therapies many a times in OT room itself, where the sensory integration can happen, or a room or a place where we can actually create a sensory integration corner and then take speech therapy there. It does really help. So that is one of the, again, recent advancement. When we say sensory integration, why do we have to have sensory integration? So every child is a different learner, right? It can be auditory learner, they can be visual learner, they can be kinesthetic learner. So there are different modalities for learning. And when it was an observation and also learning over the years, that when the sensory integration is combined with the traditional speech therapy, it does show good results. And I'm not overstepping on the role of an occupational therapist. I do appreciate their profession very well and their inputs. Just that with their help, if we can incorporate few sensory activities while doing the speech therapy, it does really help. So that is one more innovation that has taken place over the years. And if we see everything, whatever the child learns, if it is more playful, it does help. So playful in the sense it has to be very interesting. The child should be involved and he should enjoy. So when we take speech, as a speech therapist, when we take speech therapy, we do work on a lot of skills like attention, cooperation, imitation, motivation, all those things. And how do we do it? We just do it just while playing. So play has a very important role. And as we see a lot of screen time nowadays, kids do have. Screen time does have a positive effect. I don't say that it is bad for everyone, but it is also not good for a child who's on the spectrum or who has sensory issues. So the more we have play-based therapy, it does help a child in a much better way. So that is also one kind of innovation or recent advances, or I would say evidence-based practice, where play has given a lot of importance in therapy over the years. When we say innovation, what basically we can talk about innovation in? It can be a technology-based innovation, or it can be traditional therapy-based innovation. So there's a lot of technology-related innovation also happening that I will give you insight of it a little later. But right now I am more talking about the traditional based therapies, which has been improved over the years. The therapist ways have changed over the years because of the new techniques in India, and more people are getting trained in new techniques. Okay, so I spoke about the sensory part to be included in the therapy, the play-based therapy, parent involvement in the therapy. So this has been recently, we have observed that the more the parent is involved, more the play is incorporated, and better the sensory issues are being addressed, we see good improvements. This is one part. The second part, what we see, the children with autism or children who are on spectrum, as we know, they have lots and lots of sensory issues. So we as a speech language pathologist does work on their oral sensory issues, which is also a major part of our therapy. So that is also one of the recent advancements and innovations where the child has to be worked on his oral sensory issues. If a speech language pathologist wants to get trained themselves in oral issues, oral treatment, they can actually do some courses like oral feeding or oral placement therapy levels. They have different levels in that. So that is a good learning thing for speech language pathologists. I myself has been trained in those, and I see a difference when I take a therapy for a child who's on autism. When we work on oral issues, we do see significant results in like their vocalization and their attempt to talk. And many a times child with autism does have a subtle level of apraxic component, which is actually not very easy to diagnose, but with this apraxic component, if we work on oral issues, it does address that. And we have seen few kids who've been showing a drastic improvement if we work on their oral sensory issues. Other thing what we have over the years incorporated in our therapies is the prompt techniques. Prompt is also a specialized course. The things what I'm telling you about OPT, oral placement therapy, or prompt, these are all certified courses provided by different centers, and it is actually they do workshops for 2 to 3 days. A speech therapist can get themselves trained on that. So these do add value to our profession. I would consider this as innovations, because this does help us in our day-to-day practice. So talking about prompt, it also does, prompt involves working with our oral musculatures, and speech therapists are trained to help the child to make the sound Prompt is not only for children with sensory, but yes, if you learn prompt, it does help children who have autism and sensory issues. So that is one kind of an innovation which we see. The other, as I mentioned, if I repeat it again, if I say the parent involvement in the therapy, the play-based therapy and the sensory-based therapy, these are the three very important things. If can be addressed in each and every child with autism, will definitely show some different results. I wouldn't say every child is same, but still an assessment done by a speech therapist and incorporating of these things at home, even at the therapy center, does actually shows good results. Secondly, what I mentioned about was OPT and prompt. This also does have a great impact in your quality of therapy, what you take, and for parents also. If as a parent can be, they can take the home training from the therapist, how to work at home, it actually does show good results. So the next thing I would like to talk about is when I say parent-based interventions, the recent innovation is more of like Hanan programs. If you see Hanan program, More Than Words, I have also recently got myself trained in Hanan More Than Words. It's been there for few years now, and they are also working on evidence-based practices, and then they are training the therapists all over the world. So when you see More Than Words, it does also talk about how the parents can actually work with the child at home and how they can work on the interactions, how interaction leads to communication and how communication actually leads to verbal. So it can be verbal communication, it can be non-verbal communication. And Hanan program does focus on the parent role. The parent role is very important in the therapies. They have few techniques, few strategies which are Hanan therapists. You can go to your nearby Hanan therapist. They can train you on those strategies. There is a structure for this, so that you can work with your therapist and learn those techniques. So that is also one of the major advances and an innovation for a therapist as well as for the parents. Even parents can go and get themselves trained in the Hanan programs. So this is also one of the major innovation what we see. This is more when we see OPT and when we say prompt. This does help in oral output of the child and reducing the apraxic component, if any, in the child. And when we say Hanan program, More Than Words, it does help in overall communication, be it non-verbal, be it verbal. But the interactions does lead to little bit of verbal communications in future. When the kids are on the spectrum and they are non-verbal, then what? Then what do we have to do? So for non-verbal kids, we actually can still work on OPT, we can still work with them with prompt, we can still have Hanan into their day-to-day practice, and also we can use some AACs which were not there around few years back, but now again we have some programs offered by some organizations worldwide, like we have PECS for autism, we have that's called Picture Exchange Communication System, and we can actually also, there's an Indian AAC which is called Avaz. So many therapists are also getting trained in Avaz for the child with autism. So these are the programs which actually help, and obviously technology is involved in this. There are low-tech devices, there are high-tech devices which actually help kids with autism in overall communication, even if they are non-verbal kids. So yes, there is always a doubt. What I see in my day-to-day practice, when I ask a parent, a young child's parent with autism, to introduce PECS or any kind of an AAC into their day-to-day life, there is a little bit of resistance that why we should wait for the child to talk. But if we introduce AACs at an early age, it will help a child to have more overall communication, which will actually leads to less frustration, because a child who is unable to communicate themselves verbally, when we start therapy, they are unable to communicate themselves verbally, but their comprehension is increasing. Their non-verbal language comprehension is increasing. And when they get aware of their surroundings, they learn so many things, and still they are not able to express themselves, the frustration also increases. So when we increase AACs at an early age, we see that the child is able to express themselves through some mode, and the frustration and behavior issues are a little bit lesser compared to when it is not introduced. But if I talk about Indian scenario, still parents are little reluctant to have AAC. I don't blame parents. It is just that we have to create more awareness about it. Parents think that when AAC is introduced at early age, my child will not talk and be dependent on AAC only. But that's not the situation. If a child is introduced with AAC at an early age, they do develop speech. If they have to develop verbal speech, they will develop even later in their life. So it's not that introduction of AAC will hinder their verbal speech. So these are the few technological advances which I would like to focus more on. So if I repeat it again, the parent involvement in the therapy, the child having more of a play-based therapy, the child having more of a sensory stimulation in speech therapy. And in terms of oral issues, if we say the OPT therapies, the PROM therapies, and also More Than Words Hanan program, which is designed only for parents of children with autism, and also the AACs, which is like PECs or AWAS, or if you have any other AAC available in your area. The second question would rise when we talk about AAC. There are a lot of app-based AACs also. So I have come across some few apps like Autism, and there are many other apps. So when we talk, one side we talk about less of screen time with children with autism, and on the other side when we introduce app-based therapy for a child with autism, this again raises a lot of questions in parents' mind, that is it good to have a screen time, or it is good to have a screen-based therapy for my child. So it again depends that how frequently you are using the screen, what is your duration. And I would always suggest that introduction of any kind of AAC should be in association with your speech language pathologist, because they know best about it and they can guide you how an AAC should be introduced, the number of hours the AAC should be introduced, and what kind of AAC should we use. Should we stick to traditional picture-based AACs, or we have to go for high-tech devices? Again, one more question might come in parents' mind, that when we use AAC, app-based AAC, or I would not like to take the names. There are many available on app stores and Android Play stores. So they do involve some kind of cost. So is it worth buying? It again is a call between you and your speech language pathologist. Together you can take a call that what AAC works for your child. You can have an assessment, and then you can go for a formal AAC devices. So if we see overall spectrum, the kids on the spectrum, if I have to talk about with my experience, and I think most of the therapists will agree, that no two children with autism are same. Every child, be it moderate, be it mild, be it severe, whatever their symptoms, whatever the red flags they have, it will vary from child to child. So again, whatever I just now said, it has to be very individualized. Before starting any program, before getting acquainted with any kind of therapies or any kinds of techniques or strategies, again, as a parent, you should discuss with your speech language pathologist and have a team involved. You can have your occupational therapist. If you believe in behavioral therapist, you can have your behavioral therapist. And as a whole, you can sit as a team, devise a plan for your child, and then work on that. Even if you are going to in-person therapies, if you're attending regular therapies on the centers, or if you're just doing distant therapy, or you're just taking, visiting your therapist once in a week or once in a month, or you're just attending therapy once in few months and taking a home-based plan. Everything, each and every decision, whatever you take for your child, should be in association with your team, because obviously parents know best for their child, but as a therapist they also have an experience and together they can help. Not every child will benefit with all kinds of strategies available. Not every child will improve with whatever available information is there or whatever innovations or techniques are available. But a mix of 1, 2, or a combination of more than 2 will definitely help children to improve based on their levels. I as a speech therapist and my team, we have incorporated almost everything in our therapy. So we see the child, when we assess the child, we see whether they need OPT or whether they need prompt-based therapy, or the parents have to be trained for more than words. We decide based on their parents' knowledge, their understanding, and accordingly we proceed. So I think that's the best thing we should do. The relationship does matter. The innovation, whatever innovation you have to apply, but first you have to have a rapport and relationship with your therapist so that they can understand your needs and you understand what the therapist want. Because if your relationship, if you don't understand each other, having any kind of innovation or any kind of a therapy or any kind of strategy wouldn't work with the child. So mutual understanding between the therapist and the parent is very important, which is my I think it's my learning over the years, that just not working with the child but working with the parent. So we as a therapist at Here and Say Clinic does spend almost, if not equal, around close to 50% of the time with the parents what we spend with the child. Because we believe in that if the parent is not involved in therapies, they will not progress. Many a times parents who come to us, they feel that therapists are there to fix my child. If we take our children to the therapist, they will do whatever they know and they will just do some kind of a magic and my child will start talking, which is not true, and it doesn't happen nowadays when we see such a huge number of kids reporting to us in our clinics with autism. This doesn't happen because there must be something happening outside. That's why we see so many kids with autism. So only fixing the child is not possible, because there's been studies, there's been research going on about the nature and nurture part. A lot of people say that autism is because of the environment. A lot of people say the autism is because of innate abilities, and during the pregnancy it has been happened. So whatever the reason is, whatever the cause is, in your case, it has to be dealt together as a team. Going to a therapist and getting it fixed like any other problem will not help the children with autism. And if your therapies are more of family centered, family based therapies where the intervention is involved and you are taking the informed decision with the therapist, it will shows very good results. Even if the child is non-verbal, still it will show the results, because I feel that is what is more important, and that is what is the need of an hour, that children with autism or the families who have children with autism should be treated together, should go together. It should be not like only the child and the therapist interaction, or the child taking therapy for the therapist taking therapy for the child. It has to be both. Parents should also get involved, and active involvement from the parents does show great results. Over the years, we have observed the parents who are more involved in therapies, they take home programs, home training exercises very seriously, who actually come back to us, discuss with us, and show us the progress, show us some videos how the child is doing at home. Their child does show good results in terms of both verbal and non-verbal communication. The parents who are little less involved, maybe due to many reasons, I'm not being judgmental here, will, if they are not very involved in the therapies, the child will show less results. I don't know if this point has been discussed over the years or not, but I feel this is one of the greatest innovation, be it a very simple one, a very basic one, but involvement of therapies, involvement of families in the therapies is very important. And obviously we have seen over the years that not only mothers, the fathers, the grandparents, the uncles, the aunts, the nannies, everybody is involved in the therapy. So the more the number of people are involved in child therapy or just child's intervention, better would be the results, because more the number of communication partners child has, we see good amount of communication, good amount of interaction with the child and within the family. So I as a speech therapist have worked with so many kids with autism, and when I see that what works best for us in terms of therapies was mainly the parent involvement and understanding the child needs. It's very important. Overall assessment, when we do an overall assessment for the child, if we miss anything, for example, a few years back, even we were not assessing oral so seriously. We were not taking oral sensory issues very seriously, and I admit that we were also doing that. I think we missed a lot of chances where we could have worked with children. But when we learn that there are these sensory issues, when we address it, we do see a lot of improvement. That's when we actually incorporate it in our day-to-day life. So our therapists are trained in OPT, they are trained in prompt, they're trained in play-based therapy, they're trained in Hanen program. So all these things actually over the years added to our knowledge, and it changed our relationship with our children. How we were taking therapies some years back, maybe 8 years back or 9 years back, and how we are taking therapies now down the line, we do see there's a lot of improvement. So I wouldn't say that there's only one kind of innovation which has happened in the communication strategies with the children with autism, but there have been a range of things which has taken place over the years and which have been implemented in our clinic. And I would also request the other therapists, whoever has an opportunity to get trained which part of the world they are in, it would actually help your children and also the families. So I think that's my knowledge which I have shared with you. I would like to hear from you if you have any questions, or if you want to understand more on what I have said, I would be happy to answer those questions. Okay, so thank you, Stacy. Exactly, the assistive communication should be introduced as soon as possible. We need to educate parents and therapists about accepting communication difference. Verbal communication is not accessible to all autism children, and that is okay. Communication comes in many different forms. Exactly, this is what my point is. So parent empowerment is important to the child, developing a reliable method of communication. The goal should not be speaking, the goal should be communication, and if an individual has a capability to be verbal, it will happen. Oh, thank you so much, Stacey, for your inputs. And yes, I do believe in this, and I've been working with families closely, and I've been actually telling them to work more on overall communication and just not focus on verbal. How do you get parents to buy in to participate in therapy sessions? Oh, it is very difficult. We are always behind them. We tell them that first we actually very politely we introduce, okay, madam or sir, you have to get involved in your child's therapy. Do come in the session, observe the session, be there in the session, see what the child is doing, see how the child is responding, and see how our therapists are working. So initial few days we actually just request them again and again and again and again and again, and if they're still not interested, then we just make them sit near, if the child is not very cooperative with the parent around, we actually through a see-through window we make the child and the therapist inside, and I personally as a therapist spend time with the parent, and I actually tell them what is happening, why the therapy is happening, what kind of an activity we are doing, what the therapist's intent is, what is their goal, and how your child is responding. So there are days, there are months when the 45 minutes of session has happened inside with the speech therapist, and me being the other speech therapist sitting outside with the parent, seeing the therapy and actually explaining them what is happening. So that's when they get involved and they understand the importance of therapy and how their involvement will help. So we do that for some days, and after that we actually ask them to take the session. We say that last 15 minutes you have to do the activities, and we will just observe and we will guide you what better you can do. And what are the some techniques or activities the sibling can do to help their autistic sibling with communication at home. So basically we do encourage siblings to come for therapies with the parents, and we have seen situation with, like, for both the parents were working, they were doctors and they couldn't spend time with the child. So the elder sibling was actually taking care of the therapy at home, and they were only reporting it. So whatever strategies we do as a therapist, like modeling, the interaction, more of a whatever we do in the session, actually whatever based on the child's goals, whatever we have planned, we help the sibling to know those goals and we ask them to do at home. And when the sibling is in the session, many a times they are more interactive because they want to model the sibling, they want to see what the sibling is doing and they want to do it. So that has been worked with us. And even for the oral massages or oral placement therapy, when we do with the child, when we do it on the siblings first and then we take it on the child, they get more involved and they enjoy. So yes, we have involved siblings. And coming back to the buy-in of the therapy for the parents, we ask them to take the session for last 10 minutes and then we record those 10 minutes. And after the session is over, we actually show them that recording, that what they did and how they can actually improve. Because if we don't show them the recording, they say, no, we did this, we did that. Because obviously they don't know what they were doing. So when we give them a video feedback, they enjoy that and they understand that how they can actually work on that. So we believe in involving the families, and as again I said, not only the parent, the family, the grandparents, the nanny, the siblings, whoever spends time with the child, we ask the parents to bring whoever stays with you or whoever spends time with the child, you bring them to our clinic, we will explain them and we will help them get more involved in the therapist. And that is what the change we have seen over the years. When there was only parent coming to the session, and over the years when grandparents started coming, they also started following those strategies at home. There was an improvement. So obviously family-based intervention is very important, and I'm a big advocate of family-based intervention. We do get a lot of parents coming to us saying that our therapy centers doesn't allow us to sit in the session, or they don't tell us what is happening, and just at the weekend or month end they say something, someone will come and they tell us something. I personally don't believe in that kind of a therapy, because then you are not doing anything, and then again we are giving an image that we are a magician who will do some magic on the child and child will become fine one day, which doesn't happen. So if you involve the parents from the starting, this will actually make a huge difference. Thank you for sharing your knowledge, Stacey, and asking for the question. I'm really happy to have an interaction happening here and some question coming up, because when you're talking on Facebook Live, you don't know who's hearing you, who's watching you, and what you are saying is actually just talking. So I'm very happy to have your feedback. Exactly, parents should be included. Yes. So in future, if we, oh great, I could sense that you are also a speech therapist. Seeing your questions, thank you so much. And in future, if we get a chance and if we get an agreement for the parents, we will do like to share some videos of parents, if we get their concern, that how they were involved in therapy and how they could actually see a difference. So Mr. Surendra, very nice to hear that you have involved parents, but to my knowledge, hardly therapists will allow parents. Yes, sir, that is a drawback, and I think that is what my session was today. I focused more on that because I think that's a biggest innovation. That's a basic innovation, but that's a biggest innovation, that more the parents are involved, better would be the results. I have parents who have, because we are based in Hyderabad, we have parents who come from Australia, who come from US, who come from different parts of the world. They stay here for a few months, they take therapy, and when they go back with a lot of good memories. Even if the child is verbal or non-verbal, that is not in our hands. We do put a lot of efforts for everything, and in every aspect we believe the child will progress in. But even if the child is non-verbal, they see that the communication, what has happened and what the improvement has been happened over the months, is drastic when the parents are involved. We had a parent who was in US, the child was in India. I am based in Hyderabad. So the child was in India with grandparents, and the parent was in US, and the grandparents used to bring the child for therapy. The parent was involved in therapy from US. We used to actually regularly communicate to her on monthly basis or weekly basis. We used to actually give feedback to the grandparent and also the parent, so that she knows what is happening with the child. And she used to feel bad because she was just so far and she couldn't do much. So we gave her some strategies. We gave him some strategies over the phone, how she can actually get communication involved over the phone with her child. So she was away from almost 6 to 8 months, and she actually developed some kind of a relationship with the child over the phone also, like on the video calls. So I think that is what is the main crux, that involving parents, involving therapies, involving families in therapies is very important. Bangalore also, I feel there are many centers who are doing that. I think it's just that you have to find a good or a center which can actually believe in parent-based therapies. If you want, you can text me. Whatever information I have, I will definitely share with you. I'm going to sessions from 5 years for my kid, but the points mentioned never happened. I am really sorry that it didn't happen to you, but still there is a scope. I don't know what your child level is, but still you can start from today, and whatever you can do in your scope and discuss with your therapist, or if you want an opinion of changing the therapist, whatever. See, I would not say therapist is wrong. We don't know what their knowledge is, right? See, how you perceive things and how therapists perceive things, sometimes we are just not on the same page. So I don't know what thing went wrong, but you can still talk to your therapist, and if you feel that your therapists are not understanding your needs, then you might consider changing your therapist who you can understand or you can get along well first. Because I always believe, more than children, parents are more parents are the goal. We have formed a kind of a therapy environment where our therapists, who are not, they are all qualified, they are not non-qualified people, they are either bachelors or masters in speech language pathology. So they take the therapy, and I spend a lot of time with the parents. So, and they also do update their therapist, the parent, after every session, that whatever we have done and whatever I told you, that what we do sometimes with the parents. So if you are equally involved with the parents, and more than words is what I've learned now. But I've been actually, that time I didn't know the word that, parent training program and all those things. We never used those words, but we were still doing that. And we have been doing that from last 4 years now. And it does actually help. So, some resources from home. Sure. Mr. Surendra, Ms. Stacey says that you can send her a message and she can send you some resources for home. That's a great idea, and even we can do that. Or if you want, we can get you connected to a right therapist in Bangalore. I will share that information to you too. Any more questions? I would be happy to discuss that. And my experience overall with children with working with autism is if we understand the child, if we see their needs, if we understand what sensory he's looking for, that does actually change the course of our therapy. I'll give an example here. I had a child who started coming to us, it was like 4 years back. He started attending therapies when he was 5 years of age. And for an year or so, he was not talking anything. He was not a verbal child. He was always a non-verbal child. But his comprehension was increasing, his interaction was increasing. He was definitely improving, but the verbal output was very low, and that was very bothersome for us. We were not understanding how to break the ice, and again the parents are not so open to AACs in India, so it was very difficult for us. So then we thought, okay, let's try with sensory integration in speech therapy. So that time I had attended some workshop, and that's when I bought a rocking chair, a normal, bamboo rocking chair for my for this child, and we started taking his therapy on that rocking chair. And suddenly, after a month or just for 15 days, there was an improvement in verbal output, and that all our therapists were shocked to see that wow, just having that sensory connection, just understanding this sensory need, we actually saw this was a verbal improvement. And that's when we decided that we will always work closely with our occupational therapist, and we will see because we as a speech therapist are not trained to understand the child's sensory needs. Obviously with years of experience I have learned it, but again we need a help of occupational therapists to understand the child's sensory needs. And when we understand their sensory needs and when we incorporate that in our speech therapy, that actually shows good results. So we have come a long way from just using flashcards and asking what is this, what is that, to more play-based therapy, to more what you call pretend play therapies, and more of a lively therapies, I would say, more of an interesting therapy, just not sitting in one closed room and just doing therapy. We actually move around, we go to this room, we go to that room, we go on swing, and then we talk to the child, and then we sit on a ball pool, and then we do enjoy all the sensory part of the therapy, and then it is fun actually. So because yes, you say you are a certified sensory therapist, and when autistic individuals are regulated, they can communicate more efficiently. Yes, that's the key. Yes, exactly, that's the key. So we as a therapist also enjoy the session when we see that there's a lot of movement happening, there's a lot of sensory involvement happening. So we need less time, table time and flashcards, and more sensory engagement, communication facilitating activities as a part of therapy. Exactly, that is what my point is. We have a child who, when we put him on swing in the lying position and we just do a to and fro motion and we talk to the child enjoys and the child responds more. There's more interaction, there's more communication happening. So that is what, and I actually was never a believer of, closed room, flashcard kind of a therapist. Even when I was a student, I used to take a lot of children with hearing loss, with cochlear implants and hearing aids. And the closed room therapy sessions, I used to feel so bored. I used to take this child, we had some playground kind of an area in our college. I used to take the child on swing, on slides, and we used to have fun there, and we used to do therapy there. Nobody taught me actually this thing. So it was actually much before the sensory integration actually we started talking about it. That way I felt the child had actually fun, and where there's fun, where there's interaction, obviously if it is fun, it is interesting, even I would like to learn, right? So why not our kids with autism? If it is fun, it is interesting, they will also like to learn. I work with a parent who is a Saudi Arabia based parent, and we meet once in a week. We discuss her problems, and then I give my inputs, and we meet for an hour. daily. And when we had a first session, she's like, when will you start the speech therapy? I said, I'm already doing the speech therapy with you. You are going to take it to your child, because your child is on a spectrum. I can't just sit with the screen with her and guide her something. I will work with you, and you're going to work with your child. And that she felt quite interested in that. And it's been almost, I think, 3 months now we have been working with her. And last class she told me that my child, I was busy in some work, and she has a younger daughter also. Both her kids, one is on spectrum and one is a neurotypical daughter, and they both went to the bathtub and they took everything out, all the lotions, all the shampoos and everything. So and they was just having fun. So the father got angry, and because they wasted so much of stuff, and mother took it as an opportunity, and she started interacting with the child. She started giving her some commands. She was starting the right hand rub, left hand rub, and actually she saw the child was doing exactly right what she wanted the child to do, and she was actually teaching it there. So she told me that, madam, there was so much of chaos in the house, but the moment I found that it was fun, she was enjoying. I just felt I just left that feeling of, the loss or the damage done to the things and the mess around. And I just started working with my child, and she was enjoying it. She was having fun and she was learning. So this is what we want from the parents, to make your communications more fun, more lively, more enjoyable, and include a lot of sensory, so that your child will actually learn. So I think I'm actually smiling, and when I'm sharing these examples, I feel that then again I'll come back to the point that parent education is important, parent involvement in therapy is important, more the fun, more lively, more sensory. It will actually show some results. I would not say how many kids will become verbal, but at least they will have more communication. That is what is our goal is. Communication is the key. That is what our topic for today is. Communication innovation for individuals with autism, right? So thank you for interacting, Stacey, and thank you for asking doubts, Mr. Surender. I am sure you will get connected to the right people in your area, or Stacey is ready to send you some home resources. And even if you want some more help, we are always there for you. Autism Connect people are always there for you. They're doing a great job getting people involved. I was a bit conscious, and I was a bit, thinking that what should I say? What will I talk about it? And I am very happy that I could share some knowledge. And we will see more of webinars and Facebook Live coming up from other parents also, other therapists, parents, whoever is involved in the autism program. And it will be a great learning session even for us also. Thank you so much. Thank you for joining. Closing for now.